and welcome to Couched in Color with Dr. Alfiee, the show where we discuss all things mental health related to teens, youth, young adults, communities, and families, and where we always spread love and light informed by good, culturally relevant science. I'm your host, Dr. Alfiee. Today, staying with this theme of security, we're going to talk with Dr. Jacqueline Douge, the Medical Director of Health Services for the Howard County Health Department in the Maryland area. Dr. Douge is a classically trained, incredibly bright, very engaging pediatrician with lots of expertise in the area of public health, who has spent a significant portion of her career focused on the physical well-being as well as mental well-being of young people. She is expert in all things related to African American and other children of color, and I'm really looking forward to having the opportunity to learn from her about some of her work in content creation. She is a podcaster herself, as well as her work in building what she calls edutainment, blending her clinical and expert knowledge with the media to educate and inform the public about the public health needs of our young people of racially diverse backgrounds. So stay tuned. It's going to be an exciting show, and she's very energetic, and I'm really looking forward to sharing her insights with you. Can you tell us a little bit about your journey to podcasting, and then tell us a little bit about what are some of the topics, the kinds of things that you talk about on the podcast related to supporting and helping and empowering Black families and Black children?
So I think the journey was really about, being a typical pediatrician, seeing patients in the office. I found like there wasn't a lot of time in the 15 minutes that you're allotted to see a patient. And I thought there was more that could be done. And let me go back even further.
Sure.
Like for me, I think like Sesame Street really was an inspiration for me. And then as I got older, just full circle, learning about Dr. Chester Pierce. He was a psychiatrist that actually was very instrumental in forming Sesame Street. And I'm like, I learned a lot from Sesame Street. Yeah. Okay. And then so there's a power in media, and the issue too that there's also an underrepresentation of a myriad of experiences, whether you're white, Black, Latinx, or Asian. And so I think there are opportunities where if you use media as a tool, as a resource, we talked about edutainment. I think there's an opportunity to sort of normalize experiences, right? I think it's done wonders for certain communities, right? So, until you see like the first Black woman and white man kiss in Star Trek, right? That wasn't normal, right? Until you saw Diane Carroll star as the first Black woman in the series, right? That wasn't normal. So there's a power to media. And then combining that with the opportunity to educate and also talk about health, especially health disparities, to address health equity, especially when we're not represented. If you don't see a doctor of color, that you can see mirrored back to you. And the fact that there's so few of us in the profession, I think that gives us more of an opportunity and a platform to really talk about these things. So then talking about why I wanted to focus on Black children and adolescents and parenting, not just Black parents, but there are transracial adoptions, there are multicultural, multiracial families. And I know from my experience, right, I'm biracial. I have family members, extended family members, and a cousin / sister-in-law, right, because we're very close in family, who's Filipino American, Chinese Canadian, Jewish American. So there's a multitude of experiences. And so then it's kind of like, well, how do you really address all those complexities of what the Black experience is about, right? How can you affirm children, right? How can we use the concept of racial socialization to make them feel strong, feel affirmed, and even educate parents on how they can do that and help their children do that. So all that to say that developing like what is Black, my podcast was really out of, I think, a necessity and love of my culture, and wanting to really to live my purpose, to educate and to really help families. And then I called it What is Black to be a little provocative. Because like, what is it Black, right? What does it mean to be Black? Especially as my kids were also growing up, they see themselves as multicultural, multiracial, and they are, right? and it's how how they've been acculturated and their experiences and how they've been socialized. So then how do you explain Blackness to a child that may not necessarily see themselves in a stereotypical presentation of what Blackness and what Black men are about, right? That's very challenging.
Yes.
So want to take the opportunity. I'm learning as well from the experts that I have on the show. So we've had Renee Ellis Anderson. She's a Dr. Rihanna Elise Anderson, a psychologist, talk about racial socialization and talk about some of her work to work with families, to kind of just deconstruct the stress and trauma of, historical stress of being Black in America. Dr. Janie Ward, she's an educator. She has a book where, I forget the name of the book, I forget. But again, she kind of has 4 principles to help help parents create resistors, right? And challenge, and not just question Blackness and why things are happening to us, but actually giving us like tools as parents to educate and like how can you actually name it, replace it, right? So they're like 4 key things, and I'm not doing her justice. And fellow pediatricians like Dr. Ashante Anderson, who does work on racial socialization, Dr. Rhea Boyd, who's very much an advocate for addressing adverse police experiences. Now I'm also interviewing a myriad of Black authors because, again, I think books, as you're a mom and also as a clinician, they are powerful, right? And there's an underrepresentation of writers of color, but and even images and beautiful images. So I want to create tools and provide tools for families and have conversations that sort of help parents facilitate that conversation, again, to address and really raise healthy and thriving children.
Oh, I'd love that. I'd love that. So when you first started talking about racial socialization, we're all, I sort of feel like as women of color and as professionals of color and as people who have that title, doctor, whatever the alphabet soup is behind our names, we're like 1 degree of separation. Because Dr. Rihanna is one of my mentees.
Oh, wow.
I've known her since she was finishing graduate school. And so when we met, I think she might have been like a 3rd year doctoral student. And she's such a sweetheart. And she knows I love her. She was just like, Dr. Alfiee, because it's like you said, it's that having a model of someone who's doing something that you want to do and seeing that representation as you so perfectly articulated, that can mean the world to a young person. Just seeing themselves reflected somewhere on the path that they would like to get on. Or maybe they didn't even know that's the path they wanted to be on, but they see a Dr. Jackie and they're like, well, I can be a pediatrician. Because I can remember one of my mentees, we all, like I said, it's all 1 degree of separation. And because there's so few of us, geography does not keep us from being connected, right? So you probably have mentees all over the country. But there's a young sister named Dr. Erica Gerasa, who is I'm not a pediatrician, I'm sorry. She's a child and adolescent psychiatrist. And she says the thing that pushed her toward becoming a physician was going to see her Black pediatrician when she was a kid.
Yes, that's
right?
with me.
Was it
yes,
really?
Yes.
So what? Tell us about that. Is there?
So I think I was, talking about racial socialization. I think I grew up Gen X as well.
Yeah.
Maybe slightly older, but so I grew up in the 70s and 80s.
Yeah, me too.
I'll defer to you. But, I'm a guess, right? So
yeah.
Grew up in the 70s and 80s in Washington, D.C.
Yeah.
My dad went to Howard University. Okay. And so I had Black teachers.
Yep.
I had Black pediatrician.
Yep.
There were Black lawyers.
Yeah.
There was Black everything, right?
Yeah. Like Harlem Renaissance.
Okay. So, like, what couldn't I not do?
Right.
What could I not be?
Right.
So for me, there was no glass ceiling that I saw, right? And also to having immigrant parents.
Yes.
There was no glass ceiling. You were going to get you're going to get you're going to have an alphabet soup after your name, right?
Yes.
And as much as I kind of balked at that, I wanted to be American, right?
Yes.
I wanted to just stay in the background, right? You can't. Because if you want to make change, right, you have to be the change at times, right?
Yes.
And it's scary, but it's like, okay, I just got to do it because there are things I want to do, want to be, want to see.
Yeah.
And even for my kids, I want more for them, right?
Yeah.
So I need to make. And we talked about you gave a great quote from Baldwin.
James Baldwin.
James Baldwin, right?
Yes.
So like you have to make the change you want to see, and especially if you're graced with the opportunity that there is no ceiling for you. I want to create that for kids.
Yes.
I want to create that for families. Unfortunately, there are circumstances that make it harder for families to achieve and kids to achieve. But again, even from my background in pediatrics, right, it's really about where you overcome toxic stress. Average childhood experience is having a caring adult, right? You got to have somebody that's looking out for that kid and saying, you can make it, you can do it. And that's what I want to help create. And hopefully that happens with the podcast or whatever, the universe has for me in terms of those next steps to do that.
So you mentioned toxic stress. That is the thing. And I wonder if you can educate our audience a little bit about what that term means, one. And then two, what have you taught your patients? What have you read or learned or even used yourself to combat the effects of that toxic stress? So first, how do we define, it doesn't have to be a super formal definition, but how do we define toxic stress? Because I want people to understand that's a thing. Like, that's a real thing. And then in your role as an expert and a pediatrician, how do you educate families on what they can do to combat it?
So my understanding of toxic stress is really an unremitting stress, right? Because we're all gonna have stress, right? It's normal. It's positive or negative stress, right? But there's some stressors, for example, you grew up in a family with substance use. Substance use disorders or divorce. I'd say racism. I would say intimate partner violence, domestic violence in the family, right? And if it's unremitting and there's no relief, okay, it can cause physiological changes in the body, right? That's right. Usually stress hormones, and over time, if it's unremitting and there's no sort of way to cope with it, right? You're not taught coping skills. Or again, even intergener. I mean, I'm kind of going off that, but again, right? Fine. So it can lead to chronic illnesses, right? And then we talk about the health disparities that occur in communities of color or even socioeconomic status, right? As a result of that unremitting stress, right? That becomes toxic in the sense that it poisons us. It makes us sick, right? My role as a pediatrician, it's interesting. In practice, I had not learned the term toxic stress, right? I hadn't learned toxic stress until I was in my current role in public health. Okay. So. And what's your current role? So my current role, I'm the medical director at Howard County Health Department in Maryland. Wow. Okay. And before that role, I was child health. I was a child health medical director. Got it. So in that role, kind of working on systems and working in the community and working with community partners, we had an opportunity to receive a grant from the American Academy of Pediatrics to work with our local Head Start to talk about average childhood experiences. We had presentations by other pediatricians to help educate the teachers and some of the workers at Head Start to help those families. Have you encountered Nadine Burke-Harris at all in your work? Yes. Like personally? Not I know personally, you know. Okay. But I'll manifest. I would like to have her on my podcast. So yes, I know about her work. Okay. All right, she's on my vision board. There you go. There you go. That's it. So yes, I know the work that she does, and again, I think from some of the because it's becoming more prevalent and high profile. Yes. And then we have to address it, right? Yes. Because now we know that race is not the determinant of health outcomes, right? It's racism, it's systemic racism. That's right. And some of that systemic racism is leading to these stressors and adding to toxic stress, right? I mean, there are a lot of other poverty, homelessness, they all kind of intersect, right? But we have to address it, right? And I think racism is one area to address, and kind of circling back into like how I sort of work to address toxic stress and what I'm doing in my work now. Yeah. So I do it indirectly, and then working with colleagues at the health department to address infant mortality disparities. Okay. Because there's a black, white, and even in a Howard County that's fairly affluent, right? Yep. There's still disparities, right? And we know that across socioeconomic levels, black moms have even higher maternal mortality disparities, and also leading to potentially even can contribute to the infant mortality disparities. Yes. Right? So I wanna highlight, and then I'm gonna let you finish. What I want people to hear and reiterate about what you just said is that across socioeconomic status, it is not just one end of the spectrum with black women as it relates to infant mortality and maternal mortality, that these are issues that
impact us. I always like to make this visual of the bell curve. Doesn't matter where you are on the spectrum. As a Black woman, it is something about having that Black skin or having that, I don't know, it's the relationship between the systems and you being a Black woman that contributes or that impacts or that makes these two things correlated. So these systems are not functioning well for us. We happen to also be Black women within these poorly functioning systems. We end up with these disparately negative outcomes. So I want people to hear socioeconomic status is not going to save you from it. So having alphabet soup behind our names, right?
Correct.
Having a little bit of money, having access to, we have access to care. We have insurance. It's relatively easy to go get care. That doesn't protect us. So, I really am horrified and fascinated by that at the same time. But I just wanted to reiterate that point. But you go ahead and educate us about how do you help families deal with toxic stress?
So again, a lot of it's indirect,
Of course.
but in trying to help change systems and
Yes.
health systems.
Yes.
So, for example, at the health department, I'm working with my colleagues to have implicit. Well, actually, one of my colleagues is leading it. She's one of our nurses for our
Okay.
fetal infant mortality review team, and she's doing. Her name is Erin Anderson.
Okay.
And she's leading implicit bias training,
Wonderful.
right, for local OBGYN providers, right? And then I'm again graced with the fact that there are fellow pediatricians and providers, right? There was a family medicine doc who offered their time, right? So that they could share their experiences as well as educate about implicit bias.
Yes.
And that's the thing, even as an African American,
Yes.
however I want to identify,
Yes.
multi-com or multi-hyphenated person,
Yeah,
right?
yeah.
If you're trained in a system that is stacked against you, right? Unfortunately, you learn and you got to do better once you know better,
That's right.
right? So there's biases across the board.
That's right.
So again, we all have to check our biases.
That's right.
And even as African Americans, we still need implicit bias training,
That's right.
All providers need implicit bias training. So I think that's one way that we're working to help address those issues.
Oh, I love this.
And also
Excellent.
putting mental health in schools.
Yes.
And working with school systems to have mental health providers available as well
Yes.
to address some of the trauma that kids walk in the door with.
That's fascinating. So I'm just so appreciative of this idea of trying to help deal with systems. And by dealing with systems, you are it's not in a way, you are really helping to, shift the tide just a little bit so that people are less negatively impacted by things like implicit bias. And so can you talk a little bit about, because I want people to come away from the conversation educated about some of these issues, and there may be people, I don't know, who are under a rock somewhere who haven't heard this terminology. Can you talk a little teeny bit about implicit bias, and then tie that to, because I want to stay with our theme of, and as you do with your podcast, focusing on Black and brown children. What are some of the ways in which you see systemically implicit bias negatively impacting Black children?
Oh, wow. You ask great questions. So again, my understanding of implicit biases, right, are those subconscious stereotypes, generalizations we have about people that cloud our judgment or so we might judge someone differently, right?
Yes.
So the way that they look, their
Yes.
socioeconomic status, right? So culture, right, across the board.
Yes.
And then sometimes it can lead to microaggressions, right? So without you even knowing it, right? Because it comes out unconsciously, right? So again, like what I've seen in the healthcare system, we sort of stereotype our patients, right? If they have Medicaid, oh, they're always late, or her mom with multiple kids, right? There's a generalization about a single mom, right? Or being said that, oh, that doctor of color, oh, is very articulate, or where are you from? I didn't, so you're like, there's slights, right? So in terms of going back to the question of children and how do we let me have you rephrase, because I went off.
Yeah, no, it's fine. It's fine. So I'm wondering, you gave excellent examples of how implicit bias shows up for us as adults and us as professionals, right? So one example I think of is in the mental health space. People will talk about, a couple of people have done these studies where if a person calls a mental health provider and leaves their name, if the name sounds ethnically Black, they are, so many times less likely to get a return call from that provider than if the name sounds ethnically white. If they can tell or if they're guessing about by the voice that leaves the message, ethnicity, the person who sounds black is literally less likely to get a return call than the person who sounds white. And you talked about people, in the healthcare space making assumptions about a mom with multiple children. Well, obviously she's a single mom, right? If she's a black woman or a woman of color, or what kind of insurance she has to pay for her care. It shouldn't matter what kind of insurance she has. If she's got insurance, then, it should be that you treat everybody equally, even if they don't have insurance. So those examples, we know those examples exist of how implicit bias shows up for us as adults and professionals. What, in your experience, are some of the ways in which implicit bias shows up and negatively impacts black children?
Oh, I think first and foremost, educational system, right? Studies that have consistently shown disproportionate expulsion rates and suspension rates for children of color. We've seen it televised, right? A young black African-American young woman was dragged, right, in class. For example, again, still educational system, the young man from Texas who's a senior. I forget
with
his
the
name.
locks, DeAndre Hopkins. Yes, DeAndre Hopkins.
Okay, so that's like a more recent experience.
But tell people that some people may be under a rock and don't know DeAndre Hopkins' story. What is the story with that young man?
So my understanding of the story is that he does well academically.
Yes.
He's well loved and in his school.
Yeah.
He's excited to go on to secondary education, right, to go on to college.
Yes.
His hair doesn't meet the code of the school, right?
Yes.
The school has a hair length code that's only applied to black men.
Yes.
It seems, right?
Yes.
Because even young women who have long hair.
Yes.
And he happens to have locks. He'd worn his hair up, and I guess he wore it longer. And again, it violated their school dress code or hair code. And they said, you need to cut them, or you're not graduating. And so he's like, that's part of his culture of who he is.
I think he's Trinidadian.
Yes. So he's making a choice for himself. He's fighting for himself, advocating for himself, and so are his parents supporting him. I don't know if the school has changed its policies anytime soon, recently, but so that's a problem. So again, the suspension rates, hair issues in school. In terms of the healthcare, it's interesting. I think maybe how kids are treated, right? In terms of like, I think there's some studies about pain management.
Yes.
That's an issue, right?
That's
so
right.
Historically, right, it's been someone decided that African Americans had a higher pain threshold.
Yes.
Or someone who may have sickle cell disease. That's
right.
Right, who needs pain management.
That's right.
You're exaggerating that pain.
Yes.
So it does happen.
Absolutely. So this has been like incredibly enlightening for me, having you as a guest, having you articulate your vision for your podcast, which I think is wonderful, because sometimes even the act of just naming a population of young people, I want to focus on black people in their fullness, right? Everything that means to be black, right? So whether you're, like you said, multiracial, multi-hyphenated black, whether you're a person who identifies as Black American, African American, as you said, Guyanese or Haitian or Jamaican or, Nigerian, whatever your identity, if there's a part of you that's strongly identified as black, part of what you want to do is name that and talk about all the ways in which we can help to support our young black people. So I'm super excited that you had my mentee on. She is a fabulous young lady, and Dr. Rihanna is definitely, she's all about blackness, right? That she will tell you. I'm also really excited that you were able to articulate two key terms for our audience that I really want people to go back and pay attention to, particularly black parents and parents of kids of color. And that's racial socialization and implicit bias. I don't know that we have an opportunity enough, even in our homes, to talk about these kinds of things. And for me, racial socialization is 100% one of the ways in which we protect our kids, right? And as you shared, this idea of teaching kids about who they are as black people, like you mentioned DeAndre Hopkins, the fact that this young man, somewhere in his upbringing, somebody said to him that your locks are part of who you are, they're important, and you appreciate and respect and value that. That's what we call racial socialization. It is really teaching him about who he is, about the long line of his culture, his ancestry that came before him, and having that I think Dr. Rihanna would agree. Having that bolster and support him as he makes decisions for his future, right? And what the other thing that I really love about racial socialization is that it can be a grounding force for Black children, right? That's the thing that anchors you and ties you to, as I was saying a little bit earlier today, the diaspora of who you are, the diaspora of your people, the diaspora of your culture. So I'm really grateful for you bringing up racial socialization. I'm also deeply grateful for the work that you do, because in your leadership position and having that public health knowledge and background, one of the things that you're able to do is affect change by looking at systems, right? And that systems work is vital and is really important. So two things I want to ask. One, is there anything I didn't ask you about that you have this burning desire, you really want to get it out there? A message that you want to share with the audience, something that maybe from your podcast that you feel like is a theme that you really want people to hear. I want you to mention that. And then we're going to do a little exercise that I do with all my guests. So any final words or thoughts from you?
Oh, I just want to say that, again, thank you for the opportunity and the platform to share.
Yeah.
And I think it's really about our kids, right? I forget if you want to, like Frederick Douglass quote,
Yes.
if you want to build a strong man, right? Or I'm not good with quotes, right?
Okay.
But ultimately,
That's all
right, it's about children, right? So if we want the future that we want to have, right,
Yes.
we have to start now, right?
Yes.
We want to ingrain our kids with an empowerment and beauty and
Yes.
knowledge and education
Yes.
and all those things. Hug them with and surround them with love, right, and
Yes.
kindness.
Yes.
So that hopefully they grow up knowing that despite all the stuff that they're going to experience in the world, they have something that anchors them, right? Their identity.
Love it.
And that's what that's what I'm hoping to bring to the world, right?
Yes.
With my podcast
Yes.
and whatever else the universe has for me.
Yes. And so the universe is going to have Dr. Nadine Burke-Harris on your podcast. That's what we're going to put in the universe. And it's going to help you build this edutainment empire so we can all look and say, I knew her way back when. That's Dr. Jackie. She's on TV and she's on the radio and she's doing all this, that, and we're going to put it in the universe.
So I like to see myself as like a Dr. Ava DuVernay.
Oh, I love it. Oh, Ava DuVernay, I love her.
Yes,
We received that. We're going to put that out there. And I love it. I love it. So we're going to sort of anchor that wish, that belief, that dream in these little affirmator cards. So affirmators, I have a girlfriend, her name is Ada Williams, and Ada introduced me to these affirmator cards. I love them, they're fantastic. So I'm gonna shuffle them a little bit. Let me take out the ones that we're not gonna use.
Thinking of speed all of a sudden.
And I'm not good at shuffling. And so I would like to ask you to please just pick a card and then read it out loud.
Okay.
And then reflect on it for us.
Okay.
So there you go.
Okay, so I have my glasses as I'm getting older.
Do you need to get them?
No, I'm good.
Okay.
I can read. So, consideration. I am a considerate person, and my new goal is radical consciousness. From now on, I'll leave every space tidier than I found it. They probably know about me. Okay. I'll find small ways to support a teammate, even if they didn't ask for it. I will eat the leftover pumpernickel bagel, even though I didn't order it. Okay.
Any thoughts on that?
Well, speaking to me in terms of, I will find. No, actually, it was like tidier than I found it.
Yes.
Because my home office is a kind of mess. But that's the thing I think. But hopefully, my husband will appreciate that. I'll be considerate to my husband and leave the spaces a little bit tidier. Because that's the thing. Like there's always I think you are attracted to someone that's opposite, and
Yes.
hopefully, makes you a better person.
That's right.
But sometimes, he probably gets upset that I'm not as tidy as I am. But I think it speaks to me. I think I do this. I think I like to support people.
Yes.
And I think that's how you grow and
Yes.
get better, right? You have to, it's not just about you, right? It's not just about your ego.
Yes.
It's really about making space for someone else.
Yes.
And again, that consideration is kind of thinking about like putting yourself in someone else's shoes.
Yes.
And understanding like where they're coming from, so that maybe you take it, you don't ratchet up a little bit, right? You kind of like center yourself and think about before I respond where that person might be coming from.
I love it.
So that's what I'm thinking of.
Awesome. Well,
The pumpernickel bagel?
Yeah, I don't know about pumpernickel bagel.
I don't know. That's fine. I like bagels.
Do you really? Pumpernickel? I can't mess with pumpernickel.
I don't know.
So Dr. Jackie, I want to thank you again for being here with us. I am looking forward to enjoying your podcast now that I've learned about it when we met. Like, it happened really fast, like on Twitter. And I was like, oh, somebody, it might have been Dr. Rihanna, somebody I follows you. And then I went and I was like, oh, she's a pediatrician. She has a podcast. She's going to be on my podcast. And so like, just like that. And you were responsive, and it happened, you live in an area that's relatively close. So I'm just very grateful to you for being responsive. I appreciate you and your work. I'm so glad we have you in the space that you're in with the consciousness that you have to support our young people of color and our Black young people specifically. And just thank you for your work. Oh, and I got to put one more time in the universe, Dr. Ava DuVernay. We're going to make sure that that's in the universe so it can happen for you. So thank you.
Thank you so much.
You're welcome. So there you have it. A little bit of education, a lot of insight, some personal stories related to this idea of security. How do we build it for our young people? How do we support them by creating secure environments? How do we infuse this idea of security into almost the DNA of our young people? We've learned a lot from our guests, and it was really exciting to bring this episode to you. In closing, let me just say I'm really grateful to my guests for sharing their insights and wisdom. So what we'd like you to do is to follow us on YouTube, follow us on Instagram and Twitter at Couched in Color, as well as me, Dr. Alfiee. And please find us wherever you get your podcast fix. Don't forget to drop a note in the comments whenever you can. And we're really looking forward to catching up with you next time on Couched in Color. So as I always say in closing, let me wish you lots of love and light. And I'm always hoping that it's always informed by good, culturally relevant science. Take care.